Hi, thank you also for the opportunity to
Always.
update you and the on the island, the people of Guam.
So let's get right into it.
Uh,
What's our update this morning, Lillian?
our census right now is 32. We discharged several people yesterday late in the afternoon, which is good news because they're able to go home. They've healed and they've recovered. So, but they're still going through the recovery phase. So they're released to home to continue the isolation. And of the 32 individuals, we have 13 of them are still on the ICU level of care. And of the 13, we have 9 who are on ventilator support. So that's where we stand right now with our COVID census.
Okay.
If you could unpack it, because it looks like our numbers are lowering. What does that mean? Does that mean we're okay now?
Does well, we're lowering, yeah, but it doesn't mean. I mean, it could always change. We still continue to see individuals come in through the emergency room, and depending on their condition, if their symptoms are not so severe that they need hospitalization, the doctor then determines that they can be released home to continue isolation at home. But we continue to still see a stream of individuals coming into the emergency room with COVID positive test results.
Right. And Lillian, yesterday, just tragic news that won't stop coming. 2 more COVID-19 related fatalities coming within an hour
Yeah.
of each other. What can you tell us about those?
Yeah, it was really, really sad, to see that the first individual, the male individual who's 65, has been with us a little bit over a month. And so, it was progressing well. But then again, it took a turnaround. His condition just, deteriorated rather quickly. The second individual, a young woman too, 52 years old, with multiple comorbidities, actually wasn't doing very well from the very beginning, and we continued to manage her care, and was on ventilator support, and it was unfortunate that her overall system was just so compromised that she just couldn't fight the infection any further. So we lost her, and our condolences again to the family
Right.
for their loss.
Lillian, I was looking at the JIC release here, and I'm not sure if you had left it out, but it says the patient, we're talking about the 36th COVID related fatality. The patient was a 65-year-old male and was a known COVID 19 case. He was transferred to GMH from GRMC on August 21st. I didn't see anything here about pre existing comorbidities with this particular patient.
Right. We didn't really have that information other than he was seen at the GRMC emergency room because of respiratory symptoms. And so, he was tested there and then transferred to GMH. And that's the only time that we knew that he was COVID positive.
Lillian, I wanted to follow up on something that Charles Esteves had mentioned regarding the U.S. Army Corps of Engineers, and you're working with them. Can you tell
Uh-huh.
us what exactly is happening with the USACE?
Yeah, their scope of work is focused on the electrical system in our COVID care areas, because we needed help to try and make sure there's adequate electric circuitry for then if an individual in the COVID care area is on both ventilator support and needing hemodialysis, we needed to make sure, because that was what was our deficiency in those rooms. We couldn't really majority of those rooms in the COVID care 3 and 4, we even care 2 right now. It is an ICU level of care, but it can only handle provide electrical source for a ventilator. And if the individual needs to be on dialysis, we need to move that individual somewhere nearby to get the dialysis treatment. So that was our challenge, was to be able to maintain and keep the COVID individual who needs to be on ventilator, continuous ventilator support, at the same time needs dialysis treatment. So that was our challenge in a lot of the rooms in the COVID care 2, 3, and 4. So that's what their scope of work is going to be. They're focused to then augment and to enhance the electrical sources for those rooms in the COVID care area.
Are they able to do that work without, and I'm sure they are, so without compromising the patient care? I mean, are they having to like shut off the power to certain areas, or how's that being done?
Well, they're the professionals. They
Right.
know how to do it. And right now, we cleared out Tier 2 so that we can begin that work to have that electrical source for dialysis. So that area, COVID Care 2, is cleared out, and so they're working on that one. The COVID 3 and 4, I don't know exactly how they're going to accomplish it, whether it's going to be from the outside. I really have no update right now on that one, but that's the plan.
Lillian, and talking with the doctors and but business owners and people are kind of in the loop, right? So we're anticipating there's going to be decisions made to reopen more businesses, even though we might not necessarily go from PCOR 1 to PCOR 2. But if you read between the lines, what they're saying about hospitalizations is that yes, well, Dr. Hoa said it's still serious, but they're really keying in on the staffing solutions that you guys have gotten recently, and there seems to be a lot of implication that GMH has the staff that it needs to deal with COVID-19 at this current level, right? So I feel
Right.
like if we're reopening businesses, then we're kind of saying that the where we're at right now is acceptable, right? What's your
Well,
assessment on that? Do you agree?
again, it's a balancing of both the economic well-being of the island, and plus the health services that we need to provide to accommodate. And so, yes, right now we have the resources, but keep in mind the DoD EMAC resources, the 15 CCRNs, the anesthesiologists, the intensivists who are here, they're leaving next week. Although we are informed that they're not all leaving at one time, it's going to be kind of like a gradual drawdown, phase out departure. But in the meantime, we now have the additional staffing resources from this company, and they are here, about 35 total. 20 will be our ICU nurses, and some hemodialysis, some emergency room nurses, and some telemetry nurses. At the same time, 3 respiratory therapists. So we have that additional inflow of resources, and so that will help us definitely. Now, as far as opening up the community, again, for the economic well-being of the island, perhaps we do need to start, but then that's the governor's call, based on the recommendation from the physician group.
Right. No, I'm just saying that if they're making that determination to reopen the economy, it's being made with the idea that GMH has somehow stabilized, right?
Somehow stabilized for now, but then anything can happen. So we just have to be prepared for it.
Lillian, I just have to follow up on this U.S. Army Corps of Engineers. Why are they? How did this happen? Like, is it because of that April assessment, or you guys just sent out the red flag? We need help. I mean, why are we going with the U.S. Army Corps of Engineers to help us with electrical? We couldn't get a contractor.
Well, again, in all the shuffling that we continuously do every day, looking at this area, and a perfect example, the ICU on the second floor, it's constructed to have 14 rooms. But when we try to, utilize all 14 rooms, we discovered that it doesn't have all the capacity in terms of central cardiac monitoring. So every time we think we have that physical room, the physical bed, there's some missing pieces. And so with the third floor telemetry unit, that was one of the discoveries, was that we cannot put a patient in there who needs both the ventilator and the hemodialysis. And so this is where the Army Corps was brought in. There was a request to help us in a very quick manner.
Who made the request? Who made the
What's that?
request? Who made the request?
The hospital did, in conjunction with the surgeon cell. Through the Office of Civil Defense, the process is submitting a DLAN ticket.
Right.
So this was like an emergency situation. We needed to get this done.
It's an urgent
Right.
situation,
Okay.
correct?
All right. Yeah, because this report from April, the assessment, I mean, the current infrastructure of the GMH facility is in an overall state of failure due to age and a whole bunch of
Yeah,
other stuff.
it's an old facility.
Yeah.
Right.
All right.
Yes.
Go ahead.
Lillian, in closing, did you have anything?
Oh, yeah. Oh,
I can go on.
again,
but
I know
it's
you
all
can.
right.
what's that?
No, I guess in closing, Lillian.
Again, just to continue repeating the advice and the instruction to really, again, practice the social distancing, practice wearing the mask, practice, washing your hands. That's our lifestyle now. That is going to be the lifestyle, of our current situation and going forward. And it's not a bad thing to wash your hands all the time. People tend to forget to wash their hands, so we just have to keep making that as our lifestyle. Just like when we eat, we got to wash our hands, right? Wash
Yeah.
your hands, wear your mask, and keep the distance.
Thank you, Lillian. You're
Thanks,
right,
Lillian.
though, about the
All right.
washing of the hands. I feel
Thank
it.
you.
Like, if I go
Stay safe.
somewhere and I get down,
All right.
it's like, well, thank you, Lillian. Bye.
Bye-bye.
Okay, wash your hands. Thanks. Bye. Okay.
She's she's like, hurry up, get off the phone.
Yeah, I got to get there, Brad. Trying to fix electrical over here, boy. Trying to fix electrical. 9-7.